Hey mama, I'm Trish, and I need to tell you something that might tick off some people in the birth world. Birth doesn't have to be terrifying. It just needs to stop being a stinking mystery. After 16 years as a labor and delivery nurse, catching over 1,000 babies and birthing 6 of my own, I got fed up watching scared, unprepared moms walk into delivery rooms. So I created the birth education I wish every mama had. Real talk from someone who's been on both sides of that delivery room door. Right now, I'm giving you everything: my 3 signature birth courses, monthly support calls, my brand new birth pod class, and 30 days free in our Mama membership. Plus, I'm shipping you my labor birth comb absolutely free. This little tool is a game changer for natural pain relief during contractions. That's over $4,300 worth of birth education, plus a physical tool delivered to your door. Your body was made for this, mama, but you need to know your options. Get the Calm Birth Bundle at labornursemama.com/calm, C-A-L-M, because confident mamas have better births. You get a 14-day money-back guarantee, lifetime access, and it's available right now inside our app. Stop letting birth be a mystery. Get educated, get empowered, get the bundle, and get your birth comb free. If you've had a C-section and you're following your hospital's recovery instructions, you need to stop right now. What we're about to talk with you about could be the difference between healing properly during those first 6 weeks versus being in pain for months. I'm Trish, a labor and delivery nurse of 16 years who's seen thousands of C-sections, and today I am chatting with Crystal from C-Section Physio. She is a physical therapist, y'all, for 17 years. She's also a professor for over 11 years, and I'm gonna let her tell more about that in a moment. But even if you think you're doing everything right, even if your doctor said, oh, you're fine, that's normal, and if you already are weeks into your recovery, what we're talking about today can still help you. So we're gonna cover the recovery mistakes that 90% of C-section moms, and I'll let Crystal correct that if that's wrong, but I think that's pretty accurate, make, because hospitals don't actually tell you much. I'm not going to say anything but much, and you're not getting supported properly, I'm sure, during your recovery. So now let's chat with Crystal. Crystal, welcome. Can you tell everyone a little bit about who you are and why you're so passionate about what's possible when these moms know what to do during their recovery?
Hi, Trish. Yes, absolutely. And thanks for having me today. I'm so passionate about this because I went through this myself. So as a physical therapist for 17 years, I've treated many patients pre and post-op, and they all have a clear rehab plan, a clear recovery plan. So my intent was to go into my first birth, unmedicated, natural birth. I figured, I know my body, I know my pelvic floor, I've got this. Unfortunately, I did not take your birth course, which I should have, because I think that might have prevented me from having my first C-section and my second potentially. But so I went completely unprepared for what a C-section could be. I actually skipped all the pages relating to C-section because I didn't want to, bring it about.
You didn't want to have bad juju.
Exactly. But that was like a huge mistake. Mm-hmm. And the biggest aha moment for me was, oh my goodness, I had major surgery and I'm not given any recovery plan. My expectation, I've worked in hospitals before, and after surgery, as a physical therapist, we would go to the patient and we would help them, and then we would give them a recovery plan. I got nothing of that. It was so shocking to me that all I was given were a few things not to do. So essentially, I was told not to lift anything heavier than your baby for 6 weeks. I was told that I could shower, but I wasn't told how to go about that. And I was told, nothing vaginally for 6 weeks as well, but nothing about what to expect in the coming weeks, how to prepare my home, what to do. Like, are there things that I can do to make my recovery better? And there are so many things that we can do to improve recovery and prevent longer term complications and pains and restrictions.
And it floors me every time, because obviously I spend time with you. You're in my coaching mastermind, and we've talked a lot. We deep dived into your why, which you guys is so passionate. But every time I think about it, even though I know it, it's insane to me that someone who has had a major abdominal surgery is sent home, number one, to care for another human, and number two, without post-op instructions from a surgeon. Yeah, like,
yes,
it is
every
crazy.
OB should have their own rehab protocol, in my opinion. And that's sort of one of my side, wishes for the future, is that all OBs will have a rehab protocol. I think they're starting some of them.
So you
think
some do?
I know of a rehab protocol, actually. Yes. So there's at least one.
Okay.
Now I hope that it will spread.
Yeah.
Yeah. But that's, that is what really made me think, I have to change this. This is not acceptable. Like, we do need to recover. We can recover so much better. I was so grateful that I had my knowledge, but even with my knowledge that I had at the time, it wasn't quite enough. And I felt very alone. I hadn't set up a plan for my recovery. So I was just trying to wing it.
Yeah.
And because luckily I had some knowledge, but
because a lot of times this is an unexpected surgery, as opposed to most surgeries where you have a pre-op appointment, then you have a plan of care, you have a physical therapist set up, you have all these things. And for a lot of moms, in fact, like a lot too many moms end up in an unexpected cesarean, and then they're not given any information. And even thinking about you with all the knowledge you have, you're still an exhausted brand new mother who just had surgery.
And you have to care for a baby somehow.
Yeah.
While dealing with all these
with your boobs, with your bottom, all the things. Yeah.
Exactly.
Yeah. Exactly. So I would love for you to, so I know you have a program where you come alongside moms in the first 6 weeks, 8 weeks. And we're going to link to that in the show notes, because I'm just going to say, you guys need this. Like, we're talking about your body and recovery for the rest of your life. Like, it's just, it just blows me away that there's nothing in place. So we'll have information in the show notes, but I would love for you to walk us through some of the top mistakes, I guess. If you want to phrase it that way, you can correct me and we can go a totally different direction, because I like this just to be a conversation. But what do you think are some of the top mistakes that are being made in that crucial time?
So I would say the first mistake is that we're misled into thinking that we should not do anything or any exercises for the first 6 weeks. Now, I think there are certain exercises that we absolutely should not be doing, but to say that we should not be doing any is misleading, because actually you're doing yourself a disservice. Because when you have an incision, and you have more than one incision, so there's many layers, 7 layers that they cut through. And then there's we think that there's only that one scar because we see one scar on the outside, but you have also a scar on your uterus. You have also a scar on your rectus sheath. It's not stitched, but your linea alba needs to heal as well. So as a physical therapist, I'm actually able to feel those separate scars. So when I'm working on people, I'm not working just on that external scar. So I think you need to keep that in mind, that your body is healing. And when it heals, those first 6 weeks, it needs to lay down scar tissue. And you want that to happen. Scar tissue is amazing. It's great. We need it. But then what happens if you're not moving and you're afraid of moving, plus you have pain, so your posture is going to be altered because you kind of want to protect that area, then you're not going to retrain the body and that new tissue where it needs to move. So it can kind of stay stuck. So it is really important to actually start with very gentle movements. We're talking about deep breathing, 360 type breathing, diaphragmatic. There's a lot of terms out there, but you need to be breathing. Belly breathing, but also expanding the chest, because you're very restricted after surgery.
And how soon can they start that?
Day one. Day one. You don't wait to 6 weeks, but you're doing it gently. You're doing it within the pain. So for example, the breathing, you're going to breathe in until you feel a little stretch on your scar, but it's not painful. It's just a light discomfort. So I think it's important. You're going to gently progress. So the first 6 weeks, what I do is gently progress and build, but all within functional movements. So the first couple weeks is more crucial. You don't want to be damaging that tissue that's healing. So you will be very gentle, but you will be getting up. You have to get up. So this is another thing that they don't tell you, that you can manage your pressure, your intra-abdominal pressure. So when you're getting up, sitting down, moving around, having a bowel movement, you don't want to be forcing and increasing your intra-abdominal pressure, because that's going to push against your scar and cause pain.
Yeah, it sounds painful.
Yes. So learning how to manage that, and you do that by breathing. So essentially by exhaling as you're going through that harder movement through the transition, that will help have less pressure inside the abdomen, which will cause you less pain. So I do teach moms how to safely move. It's not that there won't be any pain, but there will be a lot less
and how
pain.
To safely poop.
Exactly. And constipation is a big thing after a C-section, because you had anesthesia
in general.
Exactly. After birth in general, but on top of it, you've had the anesthesia. You're not moving as much because you are in pain. So there's a lot of factors that contribute.
Well, then you have the high risk moms who may have had magnesium, or they were in bed for days prior to the C-section, and it's just a big mess.
Exactly. I just spoke to a mom today, 2 weeks. She's in bed and she knows she just found out she's having a C-section tomorrow. So yes, 2 weeks that you have not been moving very much. So things can be a bit sluggish. So again, there, it's important not to be straining on the toilet, because that'll cause you, and even just getting on and off the toilet, you might need some help. And there's also a lot of assistive devices that we use for other surgeries that could come in handy if that's something you want to have. So
and
instead of having, I had one patient.
They should probably get them like prescribed to them through insurance.
That's exactly it. Especially if you're having a planned C-section, to me, you should be getting the gear in advance. And if you have an emergency or urgent C-section, like an unplanned C-section, day one, they should be, setting this up for you so that you can have them in the first day. No one's doing this.
Yeah, it's really sad.
Yeah.
Wow. Oh my goodness. Okay. So we've talked about moving and doing the breathing. We've talked about like getting up and down and pooping. What are some other things that you want these moms to know?
So the other thing is scar care. So all of a sudden you're expected to go home and look after this incision, and you have no training in what you're looking for.
And a lot of them don't want to look at it.
Absolutely. That, even me, I've seen a lot of scars. And it's
different when it's your body.
It's like I didn't want to accept that it was there, and it didn't feel like it was part of my body. And by not looking at it, like maybe it didn't happen.
Well, and I'm sure too, I know a lot of my students, because, I spend a lot of time with them, they feel almost like their body betrayed them by not giving birth vaginally. And so looking at the scar, and I know a lot of them don't want their partner to look.
Oh, there's so much to work through emotionally. Like the acceptance and the grieving of the birth experience that I still grieve it. When I hear just the other day, I have a mom who was talking about her vaginal birth experience, which was not easy, but I still had this feeling of missing out. That I'll never know what that's like potentially.
So do you think like what we're about to talk about and the scar care could potentially help walk through those emotions of accepting it?
Absolutely. I think having people to talk to as well, having people to share, and especially if you have other people who've been there, that helps, or at least people who are understanding. But yes, I think, a first step is accepting and looking, and hopefully, changing that mindset of my body failed me into my body created this perfect little human. And
I went
how
to the ends of
amazing
earth
is
to
your
have
body.
This baby.
Yes. How amazing is your body that it's able to have this C-section and recover from it and care for a baby at the same time. That is absolutely amazing.
Yeah, I agree.
But and I do think that, maybe looking at your scar initially, I do have some strategies for that, because sometimes looking at it is hard. So if you can't initially, maybe you can have someone else start for you, because you do want someone having an eye on that scar, because you do want to monitor for any signs of infection. So you need to know what all those signs are. And then how you can progress is maybe having someone take a picture of it, looking at it on your phone so it feels a little bit removed, and sort of, baby steps. And you can also start just palpating, the physio terms, but you can start touching your abdomen, not directly on the scar, but above, just to kind of reconnect with your body. And eventually, when you feel ready, hopefully sooner rather than later, so you can monitor your scar, you can start to kind of look down. And that, I do think, has a healing aspect to it, where you're like, okay, this is my body.
And
this is part of me. This happened. Yeah. And it's okay. And it's amazing.
So after they get more comfortable looking at it and then potentially touching it safely, what would be the next steps for caring for their scar?
So
when?
Exactly. It's very important to, be monitoring to see, like, does it seem dry, or is there any leaking coming from it? When you're showering, how are you supposed to do that? So you're not necessarily scrubbing over top, which probably no one wants to do that, but you should still run water over top of it. Usually we suggest not using any soaps, but if, your doctor has suggested otherwise, you could.
Yeah.
But you want to keep it dry. So making sure that when you do come out of the shower, that you're drying it with something that's clean. So I suggest like a small washcloth that you can just, a new washcloth every time. Use a towel for the rest of your body, but for that, a new fresh washcloth every single time. And if it's hot outside, you want to make sure you're airing it out a lot as well. The other thing is the clothing options. So you don't want anything that's going to rub up against that
constricted
scar.
Right there.
Yeah, you don't want to constrict it. However, a little bit of compression is actually beneficial, but you want any elastic bands to be well above your waist. And I even suggest no elastic bands. Like, you don't want any specific compression at any level, but a little bit of
near
compression.
The scar, because a lot of us are wearing elastic bands after baby.
Yeah.
That's hard.
So you can use the wraps, though. There are elastic wraps that you can use that will help with it will help compress, which is good because it will reduce swelling. And that helps to prevent that C-section shelf that can develop as well. So that,
so are you
along
talking
with the
like a binder, or are you talking about something different? Yes.
No, I'm talking about a belly binder.
I was going to ask you about a binder, because someone got a little snotty with me about binders on my Instagram.
I saw that.
Yeah. And I'm a huge fan of binders. And did you feel like that was accurate information?
So I personally have not used one myself, but I do have clients that have used them and loved them. At the end of the day, the main thing is that it should be elastic and not restrictive. Yeah. And what's important is that it's not
for
compressing.
Support. It's not for compression.
It should be a gentle hug. It should not be compressive or restrictive. That's the main thing. You definitely don't want it pushing down onto your pelvic floor, because that, we all know, could, potentially lead to things like prolapse, things like that. But a gentle wrap that is comfortable, that doesn't feel restrictive, that's supportive, that can help reduce swelling, that is fine. Right. And if you can't afford something like that, you have alternatives. So you can use also just super high waist underwear. So my guide is that, the underwear should go up to the belly button and not have like a tight elastic band. Yeah. Or maybe if your maternity leggings were a little bit compressive and still give you that hug, that might be an option. Or if you have pre-maternity that do the job as well, you just don't want them to be too tight again.
Yeah. Right. Yeah. Which is the point. It's a binder to support you. It's not to lose weight or anything like that. It's to support. Exactly. And I know for my patients, it helps them move more. Like before they wear it, they're not getting up and moving as much. So it supports and also decreases pain.
Exactly. So it is a support. And that's the thing. You want to use it as a support initially, but you do want to wean off of it. Yeah. I recommend usually between the 6 and 8 week mark is when you probably want to start weaning off of that.
Oh, okay.
And in terms of
I usually tell them the first couple weeks. So
I mean, as soon as they feel like they can, the better, because you do want your own, your muscles, your core to activate.
I feel like for my students, it seems like the first couple of weeks is sufficient. Like they're pretty good at coming off of around 3 to 4 weeks. So
I would agree with that for the most part.
Yeah. I'm sure there are some people that are more fearful.
Yeah. And it's so individual, the healing, but for the most part, when you have the most pain is between that 2 and 3 weeks. I would say after that, the pain tends to be more manageable. So they don't tend to need that as much. But yes, exactly. You can use the belly bands to, if you're going to go out for a walk or if you're going to be up on your feet a little more, that would be a good moment to wear it to have that extra support.
What about stairs? You have any tips on stairs? If they have stairs in their house, would you prefer they stay downstairs or?
Yeah, I do suggest that they try to set up on a main floor where they don't have to do it too often. So ideally you're coming down for the day, let's say, if you have sort of that cottage style, you have everything you need. You're just going back up for when you go to bed. Some will even set up they're sleeping on the main floor for the first couple weeks until they feel a little bit more mobile, because stairs does definitely add some strain on the scar. Okay. When you do the stairs, you should be doing only one step at a time and exhaling when it's the hardest, not holding your breath. That's one thing you don't want to be doing when you're doing difficult things, is holding your breath. So exhale when it's more challenging. But I would have like sort of my little comfy recovery set up on the main floor where you have your essentials. I also like to have those, what is it called? Like a reacher or grabber tool.
Oh yeah. A little grabber tool. Yeah.
Those are awesome. Probably just for the first couple weeks again, but these little things for those first couple weeks really can make a difference. Yeah, because
your abdominal muscles, you use them for so many different things.
Oh my God. I was just thinking that today. Like, it was the biggest awakening to how much my core is involved with every single movement. Like just raising your arm.
I know.
I couldn't even wash my hair after my first C-section. That was painful. With my second, it wasn't for some reason. But
well, I did not have a C-section, but I did have a tummy tuck. And I had a little mommy makeover. And my doctor told me to take off 8 to 10 weeks, right, from work. But I was like, I think I can go back in 6 to 8. So I went back on week 7. And this was back when we paper charted, and I had to staple one of those big staplers, and I stapled, and I was like, like it was the worst. I ended up going home.
Absolutely.
And I took another week off. Yeah.
That's just like chopping vegetables or things like that. That's one thing I tell moms to avoid.
Yes, it's the same movement, and it's holy hell. So just so you know, buy pre-chopped veggies. Don't be chopping.
Oh my gosh, that's another thing is like pre-made meals for the first couple of weeks, if you can.
Agreed.
Yeah. And if you have a planned C-section, get those meals pre-made and in the freezer. So they're very easy to access.
Yeah. And then let someone else take care of you.
That's the biggest thing.
Yeah.
What made my second recovery, well, even my first one, but I didn't have the support planned right away because it was unexpected. For my second, I went into a TOLAC, so trial of labor, hoping for a VBAC. That didn't happen, but I had everything in place. I had the support. My mom was ready, waiting, and that made a world of a difference. So that's the number one thing I tell all moms, is to have good support that, will be helpful, because not everyone has a mom that's super helpful. I've had a lot of patients that they have to recruit other people because they either don't have their mom local available, or they just don't find the help that useful, or their partners, same thing. So sometimes you may need to recruit a few people to ensure that you have that support, especially in those first weeks. I suggest 4 weeks if it's the first and you don't have other small kids to take care of, and 6 weeks if you do have small kids to take care of.
Yeah, because having that toddler or that other child to take care of, that's a whole different bag.
You're going to want to lift them, and you're not supposed to.
And you're not supposed to. Exactly. So that was the one thing. So for lifting rules, because I know we always tell them don't lift anything over the weight of the baby. Is that what you guys tell as well?
Yes, absolutely. The thing is, you also have to be mindful of where you're lifting them from and to. So if you should not be lifting them from a seat that's on the floor, for example, initially, because that will cause more strain. And also I teach sort of the techniques in how to reduce the pressure on your abdomen when you're bringing them from their bassinet or their crib or the change table, because sometimes that can really bring on a lot of pain as well. Both on the scar, but also back pain if you're not doing it properly.
Yeah. So, yeah. So I know from my daughter-in-law, because she had a primary C-section, she ended up sleeping in the recliner for a while.
Yeah. Yep. I do. If you have access to one, some do like having the recliner for a few days, a week, up to 2 weeks, even sometimes. And if you don't have access to that, I suggest building a pillow ramp.
I
Because
love pillow ramps.
Oh my
Yeah.
gosh. I
And
had
you
an
can buy a wedge
appendectomy
pillow. You
recently.
can buy a wedge pillow
Yes,
too.
absolutely. But I had an appendectomy and it came in handy for that too.
Yeah.
So post-op, you're not usually wanting to lie flat. It'll probably not be possible. So building up that ramp is good. What's nice about recliners is if they're automatic and electric, then it helps you sit up as well.
Yeah.
The challenge of getting out of bed, that can be quite painful. So there are techniques that you can do to help get out of bed that will make it a little bit less painful.
Yeah. Any other like big golden tips that they need to hear?
Yeah, I think a lot of people wait for that 6 weeks clearance so that they can just go back to their everyday life. But the reality is that you're not bouncing back all of a sudden. When you do return to activities, you should do it progressively. So it's important that you have the basic building blocks, that you have learned to re-engage your core. Because what happens after surgery, the core kind of, the nerves were cut, things need to reactivate. And sometimes when you don't do the right exercises to specifically activate, they're not going to activate. So there's an example. After my first C-section, I was at the gym trying to it's the captain chair where you have your arms in this device and you're trying to lift your legs up. But my lower abs just were not listening to my brain. I was trying to lift my legs and it wouldn't happen. And being a physio, I had an idea how to resolve this. I had my partner lift my legs up for me a few times. And so I was able to control them on the way down. After doing that for a few repetitions, then I was able to lift them. This was like 6 months later, because this was COVID times, gyms were closed. So by the time I got back to one. So it's really important to reactivate things in a slow, progressive way before going back to everything. So that 6 weeks clearance doesn't mean you're ready to go back to everything you used to be doing. And you really should put in these basic building blocks before going to the next level to prevent injury and chronic pain.
Okay. So we've talked about these breathing movements that are just really easy. And I say it in quote exercises, but I really like that you can start it on day one because it gives her a measure of control as well with her healing journey. And then we talked about getting up and down, going poo. And then we talked about baby steps towards looking at your scar and accepting your scar. Now we've talked about activating your core. I was just wondering if you could talk about scar massage because I thought that's where you were going before, but you were really talking about getting comfortable with the scar, which I hadn't really thought about that. When do you start recommending full on scar massage? Is that, I know kind of, but.
That's a great question. And I recommend desensitization before 6 weeks, which can be considered a massage technique, but it's essentially what it is kind of light touch. And it's not directly over. You don't want to do anything directly over the incision.
Because it's not closed yet. It's not healed.
Yeah. Right. You need to make sure that incision is fully closed. So there's no possible entry for bacteria to cause infection. And you don't want to also disrupt, the fragile healing tissues too early because you don't want to open them.
Well, they may not want to touch it at that point.
That too.
Because it hurts. Yeah.
And you need to do it when it feels comfortable. It's not because at 6 weeks. And you should have clearance. You should have a professional look at your incision because I've had a lot of people think that their incision was closed, but I can see tiny little entry points.
Yeah, I've seen that before as well.
It's not
especially
quite ready.
On the ends. Yeah.
Yeah. You shouldn't be having a bath yet and you shouldn't be massaging and all.
Okay. So let's just say they've been cleared. It's closed. It's good.
Yes, that's usually around 6 weeks, sometimes a little earlier for some moms, sometimes a little later for other moms. At that point, they can start gently massaging. But again, you're probably going to want to do it progressively. So numbness is very common after a C-section. The desensitization that you can do from day one above the scar, that will help with the numbness a little bit. It'll start reconnecting the brain to those nerves. Yeah. And then adding the pressure later on, so massage that has a little bit more pressure, once you're cleared, that will further help with the numbness. But then you also eventually want to work into the deeper layers, because between all those layers that were cut, there can be a lot of scar tissue and adhesions can even form to organs and things like that.
Right.
And it's great. You're not going to get rid of the scar tissue, but you can make it more mobile. So that's the goal with your massage afterwards, is to get your scar tissue and your body moving in the directions that it needs to go. So the movement initially will help you with that, the specific exercises, but this will help you get to sort of those deeper layers as well. And there's a lot that you can do yourself. I do think sometimes it is good to see someone else to do sort of those deeper layers that you might not be able to access as much. But I would recommend that everyone does scar massage. Absolutely.
I do too as well. Okay, so we're about to wrap up. I had one more question. I was just wondering what your thought is on like silicone tape or any of those things, because I did that and my scar from my tummy tuck is beautiful. So I'm just wondering if you have any thoughts on like using oil, like vitamin E oil or silicone tape or anything like that on their scar.
Yes, I'm definitely a believer in the silicone tape. I personally did not use it for my first because I didn't know about it. And it was interesting because I was able to compare with my second. And what it did is essentially it made it thinner and lighter sooner. So if you want that scar to look better sooner, then definitely you can use the silicone strips. And it can only, you could probably see results in a couple months, if not sooner.
So I used it daily for months. Like I just put the tape and it puts pressure on the scar. So it might not be as raised, especially for people who get a keloid scar. So it's definitely good. Okay, Crystal, I told you before, my mamas do not like long episodes. So I would love for you, if you have anything you feel like everyone needs to know, and then tell everyone how they can find you and how they can work with you. And I'm going to let you guys know that we are going to, we did sign up for your program. So if you guys enroll in Crystal's program, you're also going to get our belly birth masterclass for free. So there's a little deal. So maybe they could use the code Labor Nurse Mama. Does that sound good?
That sounds great. Yes.
Okay. So go ahead and tell everyone where they can find you, how they can work with you, and all the good things.
Yes. So I'm on Instagram, C-Section Physio. My website is www.csectionphysio.com. And I have a recovery program that Trish just mentioned. So you can register for that. And what you'll get in that is a plan for the first 6 weeks where you're often left to your own device to figure out and wing your recovery, but you don't have to do that. You can go in with a clear plan and guidance and support. I also have group coaching calls 3 times a month, and also a community that you can access to have live support from other moms.
Which is priceless. That's priceless to be able to talk to other moms. Yeah.
It's everything.
I love that.
Yes.
Well, thank you so much for being here, Crystal. You know, I adore you. And this was a great conversation. Thank you so much.
Thank you, Trish. I was so happy to be on here. And I love you so much, both in the business world and the birth world.
Well, thank you. Okay, ladies, as always, I'm so just honored that you've spent time with us. I'm so proud of you guys for educating yourself. And if you're pregnant and you're like, well, I am not going to have a C-section, I totally understand that. But I agree with Crystal that you should be educated and prepared. So we are so proud of you for listening to the end. For those of you guys who have had a C-section, a belly birth, a cesarean, you need to follow Crystal and she can give you some great advice. We see you. We know that you are going through a gamut of emotions and recovery and all of that. So we're happy you're here. Make sure you guys hit subscribe, leave a review, and I will see you again next Friday. Bye for now.